Well, good day, everybody, and welcome to the Developmental Psychology edition of 5 Minute Psych. In this 5-minute segment, we'll look at the newborn, starting with what sensory abilities we have at birth. Then we'll look at 4 reflexes that the newborn comes equipped with, before ending with 2 general growth trends for physical development. Compared to many other animal species, we're born pretty helpless and vulnerable. So what can we do at birth? Well, most of our sensory systems are fully functional at birth, being stimulated prenatally. For instance, we're born being able to feel touch, temperature, and pain. We can detect and discriminate different odors and flavors, with a preference for sweet and a dislike for bitter and sour. Right after birth, our auditory sense is affected by leftover fluid in the ear canal, but after a few days, it catches up quickly, and newborns show a preference for speech sounds over non-speech sounds, and they also prefer their mother's voice over any other female voice. Our visual sense, however, is the least developed at birth. In fact, right after we're born, we'd be considered legally blind, with our acuity measuring around 2400, meaning that the details an infant could see in an object that's 20 feet away is the same as the details that a person with normal vision could see at about 400 feet away. But nonetheless, the newborn prefers pattern stimuli over solid colors, and they like to look at faces and complex stimuli that have a lot of contrast, given that they can barely see. The newborn does have color vision, but they have trouble telling some colors apart, like red and orange or blue and green. Now that we know how the newborn can sense the world around them, what motor responses can they do to interact with the world? Well, not much. We don't have a lot of motor control at birth, and we're not even able to lift our heads until around 2 months of age, sit unsupported until around 6 months of age, and walking and talking, that doesn't happen until around 1 year. But we're born with some reflexes that are adaptive. These reflexes are mediated by subcortical structures, and with normal brain development, these reflexes should disappear as a signal that higher brain structures are taking over. As such, doctors look for these reflexes at birth and then check that they've disappeared later on as a sign of normal neural development. The rooting reflex makes the infant turn their head toward a stroke on their cheek, and it's thought that this reflex helps the newborn with breastfeeding. The Moro reflex causes the baby to flail their arms out and then bring them in toward their body like a hugging motion, and it happens in response to a sudden lack of support to the head. Adaptively, this reflex may have helped the infant hang on to something if they were falling. The Babinski reflex happens when the bottom of the baby's foot is stroked. The toes will fan apart. And finally, the grasping reflex makes the newborn grab tightly onto anything that touches their palm, whether it be your finger or your hair. It's thought that this could help an infant hang on to their caregiver, but also it would promote bonding. Have you ever had a baby hold your finger? It definitely promotes caregiving feelings and affection. When it comes to general growth and development, there are 2 trends that are apparent. First, growth follows a proximodistal pattern, with body parts that are closer to the center of the body reaching adult proportions sooner than parts of the body that are distant from the center of the body. So, for example, our torso develops before our arms and our arms before our fingers. With proximodistal, growth happens from the innermost to the extremities. But we also see a cephalocaudal pattern in development, with growth happening from head to foot. Here, we see the head reach adult proportions first, followed by the body, and then the legs and the feet will be last. Well, we just discussed the newborn by beginning with what sensory abilities they have at birth before looking at some adaptive reflexes that we can use. Finally, we looked at 2 general growth trends for physical development. Now, aren't you glad you had 5 minutes?